All right. I'll let everyone start coming on. I'll give everyone a few minutes to log on, but in the meantime, good afternoon and welcome everyone to Recognizing Infection Risk in the Home Health Setting. This session is brought to you by Project Firstline Rhode Island under the Center for Acute Infectious Disease and Epidemiology at the Rhode Island Department of Health in partnership with the CDC. I'd like to thank you all for joining us today, and thank you all for your dedication and care that you deliver to your community in your healthcare role. Before I introduce myself, I'd like to direct your attention to the chat box. You can find the link to our pre-session survey. This pre-session survey must be completed at this time if you would like CNE, CE, or Certificate of Training for this session. Please take a minute to fill this out if you haven't already. In the next slide, I will be reviewing continuing education credit requirements. But in the meantime, while you guys are doing your pre-session survey, I'll take a moment to introduce myself. So for those of you who don't know me, my name is Teresa Jones, and I am a registered nurse on the Rhode Island Department of Health's Infection Prevention and Control Field Team, as well as serving as an infection prevention training liaison with Project Firstline Rhode Island. My healthcare career actually started in the home setting as a CNA. Since then, I have worked as a registered nurse in various community-based settings with roles ranging from school-based clinics to nursing leadership in the community. Even though my nursing roles and responsibilities have varied, infection prevention and control have always been at the forefront of my nursing practice. I'm very passionate about ideas around infection prevention and control in healthcare. I will also like to take this time to introduce our wonderful Dr. Kearney. Dr. Kearney is our consultant medical director with Project Firstline Rhode Island. And she is on this call, and she will be helping me out with questions at the end as well. There she is.
Hi, everyone. Thanks for being here. Let us know if there's any questions. We'll be in the background. Thanks so much.
Thank you, Dr. Kearney. All right. So if you could just take a moment to introduce yourselves in the chat, let us know where you're from. All right, so today I will be presenting this refresher session to you and learn how your experiences have helped you develop your practice when providing patient care. So these are our partners in today's session. We have Project Firstline Rhode Island in partnership with the Rhode Island Department of Health Center for Acute Infectious Disease and Epidemiology, as well as the CDC and the IPC Infection Prevention and Control Field Team, which I am primarily a part of. We visit skilled nursing and other congregate care facilities for quality improvement around infection prevention and control. So this 1-hour session is approved as a nursing continuing professional development activity by the Northeast Multi-State Division Education Unit, which is an accredited approver by the American Nurses Credentialing Center's Commission on Accreditation. In order to receive CNE, the following 4 steps must be completed. So the first step, if you haven't already, you have to take the pre-session survey prior to the start of this training. Abby Anderson did drop it in our chat a moment ago. Please go ahead and take a minute to just complete that now. The survey will be closing soon once the session begins. The second step would be to attend this live training. Third step, you must complete the post-session survey after the training ends. That will be emailed to you sometime tomorrow. And then the last step, if you would like CNE, you have to also complete the post-session quiz, and a link to this quiz will also be emailed to you tomorrow. Again, both links to the survey and post-session quiz will be sent to you by email tomorrow, and they will remain open for a week, closing on September 1st at midnight. For nurses opting for CNE credits, all 4 of these requirements, including the post-session quiz, are required. For our other healthcare colleagues here today, opting for certificates of training or EMS continuing education, dental IPC continuing education, we just need items 1 through 3. Number 4, the post-session quiz would be optional for you. All right, it's really nice to meet everyone. I'm really happy that you were able to join me today. I'd like to introduce Abby Anderson. That's Project Firstline Rhode Island's project assistant. Abby will be posting information for you throughout the webinar via chat, and the entire Project Firstline team is behind the scenes in support of this webinar. Project Firstline Rhode Island is a CDC training collaborative aimed to bring infection control and prevention knowledge to healthcare workers. We strive to reach all healthcare workers at their current level. So possibly some aspects of this course may seem simplistic or basic to some of you, while some information might be new. But as we know, some of the most simple actions and concepts are sometimes the ones that make the most impact. Just a few housekeeping reminders for today's session. For now, everyone is muted. If you have any questions during the presentation, we ask that you use the Q&A box. It's at the bottom of your screen. We will address your questions at the end of the session. You may also use the raise hand icon option, and we will unmute you if you'd like to speak. On that same note, the chat box is available to connect with our behind-the-scenes team members. And if you would like to be added to our subscriber list, you can drop your email in the chat, and Abby will be able to add you to the subscriber list, excuse me. The chat is open to share experiences and interact with participants throughout the whole session. So please use it as you wish. So here is our agenda for today. So we did our welcome and introductions. We will talk about our learning objectives. We will talk about risk. What is it and how do we recognize it? Where is risk specific for infection to spread in home care? Some infection control actions in a home care setting. We'll go through some case scenarios, key takeaways, and then we'll have our announcements, end of session feedback, and a Q&A session. So our learning objectives for today. So we will define the concept of what is risk. We will recognize where germs live and how they spread infection. We will identify infection control considerations in a home setting, factors that can affect infection prevention and control in a patient's home. We will work to understand the types of precautions, including standard and transmission-based precautions, and when to use them. And finally, we will apply this knowledge of infection risk recognition. All right, so let's begin. So I know this is familiar to most of you. In home care, there's a multidisciplinary team consisting of many different roles, such as nurses, doctors, nursing assistants, home health aides, therapists, social workers, dietitians. As a home care worker, you were at times walking into situations that you were not prepared for. Your patient may not have told you they have a fever, or you may walk into a home and find your patient on the floor who suffered a fall and might be incontinent of urine and feces. When preparing for a visit, you're gathering patient medical history from the medical record. I know there are times when what you read in the chart and what you witness at your skilled visit don't quite match up. When I was working in home care, I can recall many times when a visit turned into a situation that I didn't quite expect. All home healthcare workers play an important role when caring for patients, and we know our patients look forward to visits. Most of you see many patients in one day. And there are days when multiple disciplines are visiting the same patient on the same day, increasing the risk for infection. There are many opportunities for germs to spread from patient to patient as you go home to home. Identifying infection risk is one of the first steps to infection prevention. Start thinking of opportunities where infection risks presents in your workday. In a couple of minutes, I'll invite you to share your comments in the chat. So now we'll go over the concept of what risk is and how it applies to the home healthcare environment. So what is risk? Think about what risk means to you. Risk is the chance or likelihood that something could cause harm. How do you recognize risk? Can you think of a time when you spotted a risk at work or at home and took action to stop something bad from happening? And how did you know it was a risk? Had you seen it happen before, or was it something that you were taught? We know risk is a part of life. When you see a dog at a busy intersection while driving, you slow down. Or if you see a spill on the floor, you wipe it up to make sure no one slips. This is our brain naturally recognizing risk and taking action. Risk recognition is seeing the potential for a problem to happen, but seeing it doesn't mean it has to happen. You may have seen a potential problem and did something to stop it from becoming a real problem. You recognized risk and acted on it. You can use the same process of recognizing risk when it comes to infection control and healthcare. If you learn to spot the opportunities for germs to spread, then you can step in and stop them and prevent infections. So we talked about a few of them, like clinical care, such as IVs. Yes, I love that one. So working surfaces such as desks and benches. So those are things we forget about sometimes, so surfaces and how germs can live on surfaces. Also consider any electronics you bring into and out of the home. Yes, lovely. So Lori brought up that There's the nurse's bag, which can present some infection risks in itself. We will definitely talk about that in a few slides. Yes, Julianne. Poor hand hygiene and bag technique. So again, with the nursing bag and the potential for germs to grow and spread from that bag. And then hand hygiene. Sometimes in home care, we know access can be difficult. We'll talk about those things in a later slide as well. Thank you. You can continue to share so your peers can read it as well. So there are many circumstances and different situations that affect infection control during a home care visit. Recognizing infection risk in the home can be more difficult than in an acute care setting. So let's go over some factors that can contribute to an increased infection risk in the home versus in like an acute setting. So there's the healthcare worker themselves. What is the healthcare worker's experience? Have they ever taken care of patients with infectious illnesses? Was there job-specific education provided around infection prevention and control? When you're working as a home healthcare provider, it's different than in an acute care setting where you don't have your peers near you to bounce things off of or have support and remind each other of certain infection control actions. So there's risk in the worker being alone in itself. There's home environment factors. So some of the following can definitely make a skilled home care visit challenging in maintaining infection control. I'm sure we've all seen this, such as clutter in the home, generally dirty conditions, poor patient hygiene, pets, infestations, a lack or inaccessible running water, poor lighting. Just generally, we know the home setting is less structured and less controlled than a hospital environment, which presents its own set of risks. There are risks from equipment and supplies. So our supplies such as PPE, hand hygiene, sharps containers, cleaning and disinfecting supplies, are they available for your use? And are they readily and easily available? There's patient factors, such as what is the patient's medical condition and what is their functional ability? Can they self-administer insulin safely? Can they properly assess and do wound care? And if not, is there a caregiver who can? Bringing us to caregiver factors. Is there even a willing and capable caregiver? As we know, much of home care is provided by family members or caregivers. But are these family members and caregivers taught about infection prevention and control? As we all know, infection control is a serious issue. Some of the patient's families could mean well, but could be inadvertently endangering their loved one due to a lack of infection prevention and control training. As home health providers, it is a part of our responsibility to teach and ensure all involved in our patient's care is up to the task. So that brings us to knowing where germs live. So when we think about risk and infection control, we think about seeing the possibility that a germ could be spread and infect someone, and we take action to keep it from happening. As we explore the idea of recognizing risks for germs to spread in healthcare, it's helpful to consider where germs live or their reservoirs, which will help us understand how to stop their spread. So how do germs spread and cause infection? So in the following slides, we'll now go over where germs live in the different type of reservoirs, the 5 elements needed to cause a person to be sick, and the pathways of infection or how these germs travel. Although we can't see them, germs are everywhere and they need somewhere to grow, a place where they can live. These places, called reservoirs, are on and in our bodies and in the environment. The first body reservoir that we'll review is skin. So skin carries many germs and spreads them easily. Our skin itself is a barrier and serves as one of the best lines of defense against harmful germs. However, skin can also be a reservoir to these germs. Broken skin, including dry, cracked skin, like usually maybe during winter months with a lot of hand washing, makes your skin more susceptible to these germs. It's important to keep your skin moisturized and free from cracking and peeling, especially during the winter months, as well as very important to maintain hand hygiene. Many germs live and grow on healthy skin, and normally they don't cause harm. However, some of these germs can be harmful to vulnerable patients. When hands touch surfaces, germs can spread from those surfaces to that person and to others indirectly. Think of all the objects you touch daily. We talked about some of them in the chat, whether it be at work, a grocery store, or at home. We can carry and spread infection and not know it because most of these germs we cannot see. The second reservoir that we will review is our gastrointestinal system, also known as the gut. The GI system, or digestive system, has two parts, an upper GI tract and a lower GI tract. The upper GI tract includes the esophagus, stomach, and part of your small intestine called the duodenum. The lower GI tract refers to most of the intestines, like the small and large bowels, rectum, and anus. The gut refers to the entire GI system from mouth to anus. Most GI germs that cause infection come from the gut. Because these germs live in the intestines, they are also in our stool. These germs travel easily in stool from the gut to other places. These germs can be found on the skin around the groin, hands, and in the environment indirectly. The germs in stool can spread onto our hands, and then if we don't clean our hands properly, can then spread to other places. Think of like toilets, sink handles, stall doors, counters. These germs could potentially make others sick. The third reservoir in the body is the respiratory system. So the respiratory system consists of an upper and lower airway. The upper airway includes the nose, throat, and windpipe, and the lower airway includes the lungs. Many germs live in the upper airway. Germs in the nose and mouth can easily be spread to the skin and hands when you touch your face, and from there can spread to surfaces and other people. Think about one of the lung's defenses. It's to cough to get those germs out. So while coughing is a defense for the lungs, it's also a pathway or a means of transmitting that infection to someone else. The last body reservoir we'll review is blood. So we know blood is sterile and not supposed to have germs in it. Some viruses can cause blood infections such as hepatitis or HIV. If infected blood gets on surfaces in the environment, like on linens or a device, germs can grow, multiply, and then be spread. So these are our body reservoirs where germs live in our body, on our skin, our GI system, respiratory system, and blood. This brings us to our healthcare environmental reservoirs, so where germs are living in our environment. So first we'll talk about water and wet surfaces. Water exposures in healthcare settings and during healthcare delivery can place patients at risk for infection with water-related organisms and can potentially lead to healthcare-associated infections. Some of the places that we worry about this are sinks, faucets, showers, and drains. Germs can also live on dry surfaces. This includes some of the surfaces we discussed in the chat and others like high-touch surfaces, door handles, countertops, electronics. Many germs found on the body, in the air, and in stool can end up on dry surfaces, and they can spread very easily. Hands can pick germs up and move them to other surfaces and people. Germs from dry surfaces can also get on devices and can be spread when those devices are used on or in patients. Think about your laptop. Think of how many germs could have been in contact with the keyboard. How often are you cleaning it? Certain germs, like spores from C. difficile, can live on dry surfaces for a long time. Some studies have found such as 5 months or greater. The last environmental reservoir we will review is dirt and dust. So dirt and dust are another reservoir for germs in the healthcare environment. Think of like construction areas, maintenance projects, repairs, renovations. Germs normally live in dirt and soil and usually do not make people sick. However, both outdoor and indoor dirt and dust contain germs that can be carried through the air and breathed in. Think like small construction projects at your patient's home, like a room addition or renovations or outside projects. These projects that involve dust and dirt can have germs in it and have the potential to make vulnerable patients sick. The last environmental reservoir we will review is devices. So this list could be endless, of course, thinking in healthcare, but quick examples are like stethoscopes, blood pressure cuffs, pulse oximeters, a big one in home health, bandage scissors, INR machines, Dopplers. If devices that are used on a patient's body aren't cleaned and disinfected appropriately, germs can remain on those devices, and then when you go to use that device on another patient, can spread. So again, these are our healthcare environmental reservoirs. We have water, wet surfaces, dry surfaces, dirt and dust, and devices. So let's take a brief pause here and think about what reservoirs you encounter at work. Feel free to participate and add some answers to the chat. So I know we did some of these already. We talked about working surfaces. We talked about the nursing bag itself. That's a big one. That's a surface. Yes, we've got standing water on countertops. That's a really good one. Think of also clinical care such as wound cleaning. Thank you. Stethoscopes, yeah. So really anything, it's easy to, I think, to think of the devices associated with it. Really yes, fingernails. We love fingernails. Yes. So that would be a body reservoir. So as we can see, I think we could probably spend a whole day listing reservoirs we see in healthcare. Germs live and thrive in a lot of environments. So now we talked about where germs live. Let's talk about how they spread. Understanding how germs spread and how they can make people sick is important in allowing you to recognize infection risks throughout your workday. Let's look at each of these elements in a little more detail. As we do, think about how they relate to your workday and the tasks that you do. Where do you see the possibility for germs to spread? In order to cause infection, all 5 of these elements must be present. They do not need to be in any order, though. First, germs need a place to live. We call these places reservoirs. We just reviewed the human body and healthcare environmental reservoirs. Second, germs need a person to infect. That person could be your patient, one of your colleagues, or even you. Next, germs need to survive so that they're still able to make someone sick. They need a way to get around the body's natural defenses to make that person sick. And finally, they need a pathway. Germs can't typically move on their own, at least not very far, but germs need a way to get from where they live to another place or person. Keep in mind that germs spread and infections can be prevented. Acting on one or more of these 5 elements can keep germs from spreading and keep people from getting infected, i.e., infection control. We will next go over the pathways in a little more detail. Okay, so this can be a confusing graphic, but basically, the bottom of this image lists the 4 pathways for germs to spread, corresponding to different types of precautions listed at the top of this image. Certain germs can fall into one, multiple, or all of these categories. When we refer to transmission of infection, we refer to touch, splashes and sprays, clinical care, and breathed in. The first, through touch, usually involves the skin, especially the hands, but it can also happen with devices indirectly. It could be like a handshake, taking a patient's pulse, or touching an object like a cell phone or door handle. The next way of transmission is through splashes and sprays of blood, body fluids, or water from a sink or other source. Germs in those splashes or sprays can get into a person's eyes, nose, mouth, or a cut or break in the skin and can cause infection. The third transmission is through clinical care tasks that bypass or break down the body's natural defenses. So think of our earlier example of the IV. To insert an IV, the patient's skin has to be broken, which creates the potential for infection and a pathway for germs. The last common pathway for germs is through breathing in, inhaling respiratory particles, or exhaling infectious respiratory particles by sneezing, coughing, singing, or laughing. And again, they correspond to the different precautions at the top of the screen. All right, so this brings us to our first poll question, which should be popping up on your screen in a minute. So there are 4 pathways for infection to spread. Which of the following is not one of the pathways? Is it touch, splash or spray, breathed in, or wet surfaces? So pathways are how germs spread. Which one of these is not a pathway for infection to spread? Awesome. Great, everybody. So most people answered wet surfaces. That is correct. So wet surfaces are a reservoir or a place where germs live, while touch, splash, or spray, breathed in, and the last one missing was clinical care, is a way that germs can spread. So here are some questions to ask yourself before performing clinical tasks to help you recognize risks and stop the spread of germs. Think of this as a little timeout prior to performing care for your patients. What reservoirs are involved? What pathways might move germs in and out of each reservoir? Is it possible that the task I'm about to do will cause germs to spread from a reservoir? What actions can I take to help stop the spread of germs and prevent infections to protect patients, myself, and my coworkers? All right, so far we have reviewed what risk means and how to recognize infection risks. We reviewed where germs live, or the reservoirs, and how they spread to cause infection. Now let's talk about how we can protect ourselves and our patients from the spread of infection. All right, so we're talking about the clinical care bag now. So when home healthcare workers make a home visit, they bring various medical supplies depending on their role. Where do they put all these supplies, and how do they assure they are safely transporting everything house to house and maintaining proper infection prevention? All home health clinicians have a clinical bag that they carry various medical equipment such as stethoscopes, pulse oximeters, BP cuffs, etc. This bag holds many medical items needed to care for their patients safely and effectively. Adhering to proper technique around the use of this bag will decrease the risk of transmitting germs from patient to patient or from patient to healthcare worker. Let's review some of these steps on the screen. So, when you're carrying your bag into the home, never place your bag on the floor. If you do not have space to place it anywhere, try hanging it from a chair or a door hinge or knob. You don't want to place the bag on a couch or chair unless you are able to put a barrier down first. If you must place your bag on a surface, use a disposable barrier. Place the barrier down on a dry, hard surface and then your bag on top of it. Always clean your hands prior to entering your bag. Take out the items that you would be using and place them on your barrier, and assure that you have taken out everything that you will need to decrease the number of times you're going in and out of your bag. If you do forget to take something out, though, that's okay. Just make sure that you clean your hands appropriately prior to re-entering your bag. Always keep your bag closed when not in use. You want to prevent any chance of germs or other things entering the bag as much as possible. When care is done, make sure you clean and disinfect items and place items on the clean barrier until they're dry. Then clean your hands again and place decontaminated items back in your bag. Any items that cannot be cleaned in the home should be placed in a plastic bag, sealed, and placed in a container designated for dirty items. Remember to clean and disinfect your nursing bag per your facility policy. Ask your facility leadership if you need to review the policy. Ensure products used are appropriate for use on your bag. So for instance, a lot of cleaning and disinfection supplies are marketed for hard, non-porous surfaces, whereas a lot of bags are porous. So ensure that your cleaning and disinfection supplies are for the use on porous materials if your bag is not hard, non-porous. And ensure that you are following the directions on the cleaning and disinfecting supply. Standard precautions. So as you're going about your workday, there are certain things that you're likely already doing to reduce the risk of spreading germs, like cleaning your hands between tasks or cleaning and disinfecting shared medical devices. Standard precautions, as we know, are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status of the patient, in any setting where healthcare is delivered. Because risks will always exist in healthcare settings, we follow these standard precautions to protect patients and ourselves. The use of precautions in home care differs significantly from those applied in hospitals. In most cases, the use of gown, gloves, and masks in the care of homebound patients is recommended to protect the healthcare provider, not the patient. Organisms such as multi-drug resistant organisms may be transmitted to other home care patients through objects or hands. Therefore, home care patients known to have a multi-drug resistant organism should be cared for through the use of appropriate barriers. Reusable equipment such as stethoscopes and blood pressure cuffs should remain in the home or use the patient's own equipment if they have their own as much as possible. If it's practical, such patients should be seen as the last appointment of the day. If this is not possible, visits should be scheduled in a way to avoid seeing patients at risk, such as those requiring wound care, or immunocompromised patients, such as oncology patients, after seeing a patient with a highly infectious infection. So if it's impractical to end your day with your patients with highly infectious infections, try to order your care in a way that you are not putting those vulnerable patients at a higher risk by seeing them directly after. Adhering to standard precautions are frequently where healthcare workers can become complacent. We are very busy, so the extra few minutes to wash our hands more thoroughly or cleaning used medical equipment thoroughly can seem like it would take too much time. These are the small things that can make a huge difference. As healthcare workers, we have an obligation to our patients, coworkers, and our families to maintain standard precautions for infection control while caring for patients. Standard precautions involve close attention to all of the following on the screen. So cleaning hands, we consider that the most important principle of infection control. It is the most critical protective measure against cross-contamination in a healthcare setting. Unless hands are visibly soiled, an alcohol-based hand sanitizer is preferred over soap and water in most clinical situations, unless you've just used the bathroom or you're going to eat, and again, unless your hands are visibly soiled. Alcohol-based hand sanitizer is the preferred method of hand hygiene. Here are only a few moments, we know there are others, when you should clean your hands during a home care visit. Immediately before touching a patient, before performing an aseptic task or handling invasive medical devices, before moving from a soiled body site to a clean body site on the same patient, after touching a patient or the patient's immediate environment, after contact with blood, body fluids, or other contaminated surfaces, and immediately after glove removal. So as I discussed a little earlier, in the home setting, sometimes access to these hand hygiene supplies is limited. Assess the home care environments for availability of a safe and clean sink, hand soap, and paper towels for drying. If any of these elements are not present, we advise you to inform your supervisor so they can aid you in identifying a sink and/or procuring soap and paper towels for your use. As far as alcohol-based hand sanitizer, ensure easy access to freestanding bottles for use before, during, and after patient care. Next is the use of personal protective equipment, or PPE. So wear gloves whenever there is the potential for contact with blood, body fluids, mucous membranes, or non-intact skin. Do not wear the same pair of gloves for the care of more than one patient. Never wash your gloves. And clean hands immediately after removing gloves. Gloves are not a substitute for hand hygiene. Wear protective clothing such as a gown, booties, or anything else you might need that covers your skin and personal clothing during procedures or activities where contact with blood or body fluids is anticipated. Wear mouth, nose, and eye protection during procedures that are likely to generate splashes or spattering of blood or other body fluids. And then remove your PPE before leaving your home visit. Next standard precaution is respiratory hygiene and cough etiquette. Remind your patient to cover their mouths, noses when coughing or sneezing. Cough into your elbow and not your hands. Use tissues and dispose of them properly in the wastebasket. And teach your patients to not leave all their used tissues on the bedside table or in their pockets. After disposing of a tissue properly, clean hands immediately. Next is safe injection practices. Sharp instruments can act as a source of cross-contamination if not disposed of properly. This could be administration of a vitamin B12 injection, or if the patient self-administers insulin or Lovenox. Where do they dispose of the used needles? Is it in a safe puncture-resistant container? Some home care patients will discard used needles in a sharps container or another puncture-resistant container like a laundry detergent bottle or coffee can. As clinicians, you should be equipped with a biohazard container for used needles, sharps, or venipuncture devices. You should place the full containers where recommended by your facility's policy. If the instrument is disposable, the healthcare provider must assure that the safety cap is on and placed in the approved disposal container. When you go to discard the used needle and syringe in the proper biohazard container, please assure that the container is not past the overflow line. And lastly, never recap needles after use. Many sharps injuries happen when recapping needles. Next, we'll go over cleaning and disinfecting environmental surfaces. So cleaning is defined as physically removing most germs and dirt and impurities from objects and surfaces, while disinfection kills the remaining germs on surfaces. So cleaning and disinfection are two different concepts. Pay special attention to disinfectant labels to ensure that you're using them per manufacturer's instructions and that they are effective against relevant organisms. Be sure to clean and disinfect shared medical devices, as well as any items that you bring into and out of the home. Think even writing utensils, tablets, your personal cell phone. Utilize disposable equipment when possible and discard at the patient's residence. Also consider dedicating supplies to individual patients whenever possible. The next standard precaution we will review is waste management. So waste that is produced from a procedure must be disposed of properly. If you're doing wound care, discard the dirty dressing materials in a bag and tie it up when you're done to prevent it from potentially infecting someone else. The last standard precaution that we will talk about today is laundry in a healthcare setting. So when you dispose of soiled linens, carry these linens to the laundry bin. Keep the soiled linens rolled up and away from your body, containing any infectious material. Try very hard not to shake or aggregate the linens at all so as to not aerosolize germs. All right, so this brings us to our second poll question for today. What of the following procedures are standard precautions? Hand hygiene, a clean and disinfected environment, respiratory hygiene and cough etiquette, none of the above, or all of the above. Great, awesome. So you did all of the above. And if you said hand hygiene, you're also right. That is also the answer, but it is hand hygiene as well as clean and disinfected environment, respiratory hygiene, cough etiquette, as well as the other elements we discussed on the previous slide. Really good job. Thank you for that. So while standard precautions are always used, transmission-based precautions are the second tier. So I know this image is probably familiar to most of us. So this is the classic division of transmission-based precautions in healthcare. In a hospital or skilled nursing facility, these are usually posted outside of a resident or patient's room. This is another stark difference from home health versus healthcare facilities. In home care, you do not have this signage upon entering the patient's home. So the terminology contact, droplet, and airborne are used only when referring to precautions. Each different type of precaution has the recommended PPE to use depending on the patient's diagnosis. So this yellow sign is representative of contact precautions. Green is droplet, and the blue is airborne. Oops. Wow. Sorry about that. Made me dizzy. Any additional precautions and PPE to use is based off of your assessment and critical thinking. So again, it will list the PPE associated with the type of precaution, but anything additional that you elect to use will be based off of your assessment and critical thinking. So say if you have a patient on contact precautions for C. diff, and that patient also has a G tube that needs to be flushed. There is a potential for sprays and splashes, so you would want to also wear a mask and eye protection along with your gown and gloves. Again, the terminology contact, droplet, and airborne are only used when referring to precautions themselves. So as healthcare workers, we want to recognize, act, and protect. So we have learned how to recognize infection risk. We reviewed how some actions can cause risk and spread germs and infection. And we reviewed precautions on how you can protect yourself and others, especially your patients. So this will bring us to our case scenarios. Let's apply what we've learned and review it with the following scenarios. Okay. So feel free to answer in the chat. So you're admitting a patient to home care services. The patient is 78 years old, and she is 2 weeks after her abdominal surgery. She was diagnosed with C. diff 2 days ago. So what precautions would we adhere to? And then what PPE would we want to wear during our visit? So the patient's 78 years old. She's status post-abdominal surgery 2 weeks ago and diagnosed with C. diff 2 days ago. So the group is agreeing, and I will agree with the group, that it is contact precautions. That is correct. So in addition to standard precautions that we're always using, you're going to also use contact precautions. And as a lot of us have stated, PPE would be gowns and a glove while performing clinical care. Make sure, again, that you doff PPE when you're done with clinical care and dispose of dirty PPE in a proper waste bag. Always perform hand hygiene after doffing. Yes, you guys did great. Thank you. Okay, so that brings us to our next case scenario. So again, you feel free to just enter answers into the chat. So you arrive to your patient's home to remove her surgical staples. You learn her husband tested positive for influenza 2 days prior. Your patient reports she started with the following symptoms this morning. She has a slight fever, a cough, and a runny nose. What precautions should we take, and what PPE should we wear during the visit? So we're going to the patient's home to remove surgical staples, but her husband tested positive for the flu 2 days ago, and now she has some symptoms. Nice. Okay, I see some of the correct answers. So this is a tough one. This one, again, we're always using standard precautions, but it's going to actually be droplet, considering how flu travels. Think of like coughing and sneezing, as well as contact. And I also saw that someone mentioned we'd want to be careful of where the husband is in relation to our patient. So this is one we'd also want to be using our critical thinking for too, depending on the task that we're using or that we're performing, excuse me. Really good job. And then PPE that we would wear, we would want to wear gown, gloves, and a mask. A surgical mask should be worn by us as the healthcare worker with suspected, or even in this case, a lab confirmed case of influenza. Remember that that husband is also in the home, even though he's not your patient. Proper hand hygiene prior and post-patient care is really important. This is also, as someone alluded to in the chat, a really great opportunity for patient education. We can teach respiratory hygiene, frequent hand hygiene, discarding our tissues after use and not putting them in our pockets, and cleaning and disinfecting surrounding environment and surfaces. Great job. All right, and this is our last case scenario. So this is a patient who has a Foley catheter, so an invasive device, diagnosed with VRE, or vancomycin-resistant enterococcus infection. He needs bathing and his brief changed, as well as the Foley bag needs to be emptied. So what precautions should we take and what PPE should we wear? While we're thinking about that, let's talk about VRE, or vancomycin-resistant enterococcus. So VRE is usually spread by direct contact with hands, environmental surfaces, or medical equipment that has been contaminated by the feces of an infected person. So again, VRE, vancomycin-resistant enterococcus. And it's spread by direct contact with hands and surfaces. Lovely, lovely. Awesome. So I'm seeing a lot of, we're using our standard, of course, but in addition to that, we're going to use contact precautions. And when providing care, we are going to use disposable gloves and wash our hands with hand sanitizer. A disposable gown should also be used if the type of care will involve washing or turning the patient or changing briefs or emptying the catheter bag. If you anticipate splashes or sprays from emptying the catheter bag, consider the use of a face shield or goggles. When caring for a patient like this, you would want to work from the clean areas to soiled areas and not from dirty to clean. After emptying the Foley catheter bag, wash your hands before you turn the patient. Good job, everyone. Really great job on the case studies. So everyone did a really awesome job, and I really, really appreciate your participation today. So as you think of all that we reviewed today, what actions will you take to decrease the risk of infection in your workday? If you'd like to share, please feel free to drop your answers in the chat. And while you're thinking about that, I'll go over some of our key takeaways from today's session. So risk recognition is seeing the potential for a problem to happen. You control healthcare infections when you recognize infection risk. Knowing where germs live helps stop the spread of germs. There are 5 elements that must be present to cause infection and 4 pathways for infection to spread. Always consider what type of precautions may be needed for your patients. So again, thank you very much for joining us today, and I really appreciate your participation in our discussion in the chat. I see some answers to my last question. So we're talking about good hand hygiene, using precautions diligently, and I really like Lori's stay home when ill. So taking care of ourselves in the same way that we take care of others. It's also a way to take care of others by not bringing our illness into their home. So I hope to see you all again at our future webinars. Again, I'll remind you of the certificate of training requirements. You had to have had filled out the pre-session survey, participated in this entire webinar, and then the post-session survey, as well as the quiz if you are getting CNE credit, will be emailed tomorrow, August 26th, and both will close on midnight on September 1st. Certificates of training will be emailed out on September 5th. Any post-training resources in the PowerPoint will also be emailed out sometime this afternoon. If you didn't enter your email earlier in the chat box, please feel free to enter it now to be added to our distribution list for upcoming trainings. And you can also follow Project Firstline on social media, all the social media, X, Facebook, Instagram, LinkedIn. And then we have some upcoming sessions. These are from my colleagues Allison and Chinumso. We are doing preventing HAIs around MRSA specifically, and infection control reminders for healthcare workers during respiratory season. So if you add your email, you'll be on the distribution list when those dates and times are announced. We have some references for the session today, and that is it. So thank you all for joining us today. There should be an end of session feedback form coming up on your screen now. It's optional, but I would really appreciate if you did fill this out. It helps us improve future sessions and assess your learning needs and requests. This is not the post-session survey. The post-session survey is still going to be emailed to you tomorrow. On behalf of Project Firstline Rhode Island, we thank you all for joining us today, and we hope to see you all again. We know you all work so incredibly hard in your various healthcare roles, and we really thank you for all that you do for our patients in our community. And I thank Miss Abby Anderson. She's dropping some information in the chat for you guys. Awesome. All right. So I know we did cover a lot today. Thank you so much for your time and attention, everybody. And I know I brought you right to the end of the time, but I'm happy to answer any questions you may have. You could put questions in the Q&A box, or alternatively, we could answer questions later if you send us an email.
Awesome. Well, I don't see anything in the Q&A box right now, and we don't want to hold
Thank you.
anyone too late. So if anyone thinks of anything, feel free to send us an email or contact us through any of the social media channels. And thanks for joining us today. It was really great, Teresa. Thanks so much.
Thank you. Thank you, everyone, for coming. And we hope to see you at future sessions. Have a great rest of your Monday. Yeah, great rest of your Mondays.
Monday.
It's still Monday. Have a great rest of your Mondays, everyone. Thank you so much for joining us.
Bye, everyone.